Okay, welcome all, and welcome Professor Duong, and at the EHJ for the ESC 2014 in Barcelona. And so we will be talking about your new study about microRNA in heart transplant. So you are a cardiovascular pathologist, and so you are working in the Paris transplant group, which is a group with a multidisciplinary group with nephrologists, pathologists, epidemiologists, immunologists, geneticians, all working together in the field of transplantation, heart transplantation, but also kidney transplantation, other transplantations. And so today you will be talking about the problem of heart transplantation, because heart transplantation is a real important problem if we want to follow the patients who had a heart transplantation. We have to do regularly muscular biopsies, heart biopsies. So we are taking invasively pieces of the heart. So around 10 or 15 times the first year after the transplantation, and at least 1 or 2 times a year in the follow-up. So it will be very interesting to have new biomarkers avoiding this invasive muscular biopsies. So what have you done exactly in the study?
In this study we have chosen to use microRNAs as biomarkers of heart rejections. MicroRNAs are small molecules that are involved in a wide range of physiopathologic events and diseases. And in this study we have chosen 14 microRNAs that were potentially involved in heart rejection. And we test the expression of these microRNAs in the tissue, but also in the serum.
Yes, because microRNAs have been tested for different varieties of diseases and problems, and also in heart biopsies, many people and many teams have been trying to discover new biomarkers. So why do you think your approach was successful compared with others?
I think we have really carefully chosen the microRNAs in 3 families of these biomarkers. I mean, we use microRNAs involved in endothelial physiology, endothelial injury, endothelial apoptosis, microRNAs involved in inflammations, like miR-155, that is a very inflammatory microRNA, and also we used microRNA involved in cardiac physiology.
And also your approach was a 2-step approach. You had a tissue approach and then a blood approach, which was probably one of the
I think
yes.
the most important results of our study is in the peripheral circulatory microRNA approach. Our approach was first to study the expression of these 14 selected microRNA of interest in the tissue, and then for the microRNAs that were RNA that were the most expressed in the tissue, more deregulated, we study them in the serum, and we find that 4 of them were very predictive of ongoing rejection.
Yeah, so the secret of your approach was to take this 2-step first tissue and then to confirm in the blood, because the other teams have been trying to find out directly from the blood, and there was no results directly from the blood. So this was, and so how many, can you just briefly describe the study, because you had how many patients?
Yes, we had in the test cohort, it was a case control study. In the test cohort we have 60 patients 30 patients ongoing rejection on the myocardial biopsy, and we've matched with 30 patients with stable allografts. And
so that was your cohort.
Yes, it
Your study cohort.
Our study cohort.
And you confirmed also your results in other cohort.
Yes, we confirmed in a independent cohort from 3 different hospitals, French hospitals, in the serum, and we obtained exactly the same results.
So can you briefly talk about the results?
Yes, we find that these 4 microRNA, miR10A, 92A, 155, and 31 were strongly predictive of ongoing rejection, and it was true in T-cell mediated rejection, of course, but also in this new type of rejection that is a major issue in heart transplantation, that is humoral rejection, antibody mediated rejection, that is associated with anti-HLA antibody.
So in fact, the predictive value of these 4 microRNAs were exactly the same that you can obtain from myocardial biopsies.
Yes,
that's very impressive in the results. It's exactly the same. So yes, we don't lose any information by measuring in the blood these biomarkers, comparing with this invasive approach. And yes, is it costly? Is it complicated, this approach? How can
for testing the expression in the serum of these 4 microRNA, it costs about 500 euros, and we try to put it in the routine way now. We are not at the step of using it in the clinics, but we're on a good way, I think.
And so in the Paris transplant group, this multidisciplinary expertise and approach, so now you will be able to propose to doctors or medical teams or people who will be interested to measure it for them, for other teams.
Yes, you're absolutely true. We can contact us on our website or on the emails, and we can, the other teams can send us some serum, and we can do the experiments and the study for them.
So they have to send one sample, one blood sample, and it's enough?
I think it's enough, yes.
Okay. So that's very interesting. So because it's not invasive, yes, it's less costly, because when you do the muscular biopsies, the heart biopsies, then you have to admit the patient to the hospital. It's quite expensive, and most is invasive and associated with some complications. So compared with this old approach, this new approach is very non-invasive, non-costly, and exactly with the same predictive value. So that seems very interesting.
What is important to say to finish is that this approach will spare 70 to 80% of the biopsies, but it will guide the performing of the biopsies. The biopsies will stay the gold standard for the diagnosis of rejections, but this approach, the serologic, the peripheral approach, will guide the biopsies, and I think it's an important issue.
Oh, so thank you very much. That's a very exciting presentation about these new tools, how to measure heart transplantation. So thank you very much, Professor Duong, and I hope that people will contact you in order to have some advices, and maybe also they send some blood in order to have some measurements for their patients. So thank you very much.
Thank you.